Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Fanconi's anemia. Fanconi anemia is a rare genetic disorder that affects the bone marrow, leading to a decrease in the production of all types of blood cells, like that of the RBC, WBC, platelets, all types of blood cells. The age of onset of Fanconi anemia can vary among individuals. Some people with Fanconi anemia may show signs and symptoms in early childhood, while others may not be diagnosed until later in childhood. Maybe in puberty, maybe around the age of 20, sometimes it is diagnosed. The severity of Fanconi anemia can vary among affected individuals. The condition is typically diagnosed through genetic testing and may involve various medical interventions. Hypersensitivity to chemotherapeutic agent that cross-link DNA and increased risk of bone marrow failure and leukemia. These two are associated with Fanconi syndrome. So this is a hereditary genetic disorder and bone marrow is mostly affected, and these persons are hypersensitive to chemotherapeutic agents. Okay, so there will be DNA damage and there will be non-repair of the DNA. There will be chromosomal anomaly, and the variation and anomaly may vary from person to person. Okay, so this is an image I have picked up from Google Image, from Medina's Academy Google Image. We are looking at the appearance. Fanconi's anemia, or what are the problem? Certainly bone marrow failure, skin changes, there may be vitiligo, or maybe cafe or late spot. Okay, there will be pancytopenia, there will be decreased number of erythrocyte, leukocyte and platelets. All of them will be decreased. Short stature, stunted growth, milestone of development is less, and there may be low IQ, and a lot of anomaly. Maybe anomaly in the thumb may be missing, maybe the radial bone radius may be missing. There will be kidney anomaly, there may be anomaly in the gastrointestinal system, there may be congenital heart defect, there may be testicular or genital problem. Okay, in the eye there may be microphthalmia, small eye, or there may be strabismus, like this crossing of the eyeball. Fanconi anemia is typically inherited as an autosomal recessive manner, usually, but de novo mutation, that is new mutation that occurs spontaneously, can also occur, leading to the condition in individual without a family history. So it runs in the families, but someone may get Fanconi's anemia just by mutation, new mutation. Some cases may involve compound heterozygosity, where an individual inherits two different mutated alleles of the same gene. Fanconi anemia is a genetic disorder with a complex etiology, means cause, involving mutation in a group of genes associated with DNA repair. So DNA is not repairable in many cases. DNA may not tolerate environmental condition, chemotherapeutic substance. So there will be variation in the chromosome and also different manifestation. Clinical features of Fanconi anemia. We have seen that image. Let's go there. Bone marrow failure, congenital abnormalities in the heart, in the gastrointestinal system, in the respiratory system, in the genitourinary system. Hematological abnormalities, there will be pancytopenia, decreased red blood cell, decreased white blood cell, decreased platelets. Increased cancer risk, it may be myeloid leukemia, it may be solid leukemia, even it may be the squamous cell carcinoma of the skin. So we may have cancer, it may be solid tumor, it may be myeloid leukemia, it may be skin cancer. Hormonal abnormality is also common in a person of Fanconi anemia, and person may develop other diseases like diabetes mellitus or hypothyroidism. Growth deficiency and developmental delay, gastrointestinal genitourinary anomalies, cafe late spot on the skin, light brown pigmented patches, even we may have white spot, large spot, that is vitiligo. Ophthalmologic changes, we may have small eye, that is microphthalmia, there may be strabismus. Hypersensitivity to chemotherapeutic agent that cross-link DNA. So these are the clinical features of Fanconi anemia. Diagnosis of Fanconi's anemia, clinical evaluation, complete blood count, chromosomal break test, molecular genetic testing, family history is important, prenatal testing may be required if there is any family history. Early diagnosis is crucial for the management of Fanconi's anemia. By clinical evaluation, we may find out the stunted growth or delay in the milestone of development. Okay, complete blood count. We may go through family history. Okay. Treatment, supportive care, blood transfusion, hematopoietic stem cell transplantation, regular medical monitoring is necessary to address complications and manage diverse clinical aspects like that of renal agenesis, kidney agenesis. There may be horseshoe-shaped kidney. The testis may not develop. The thumb may be missing. The radius is missing. Okay, that may happen. Gene therapy, so look at the clinical aspect, diverse clinical aspect, we'll manage accordingly. Gene therapy, this is a new approach, but its success is not very much remarkable yet. Genetic counseling is important for affected individuals and their families. And that's all about Fanconi anemia. Fanconi was a Swiss physician. He first described this condition, and that's all. So please support my channel, please subscribe me, and please share the information with your friends. If you have any question, please feel free to ask me. Have a nice, wonderful and blessed day. Bye now.